Hello everybody and welcome. Dennis is here and this is Open Heart Surgery Survivor Series episode number 2. Today I'm talking about immediate recovery and the first few months after the surgery. If you are just tuning in, let me introduce myself. My name is Dennis and I had mitral valve replacement surgery in 2014 and I'm doing a short video series of my recollection of experiences that I had to go through and things that I'm going through right now, right after the surgery and 4.5 years that follow. So episode number 2, please enjoy it. So my surgery was conducted on June 11th, 2014. I was able to return to work on October 1st, 2014. So that's definitely a few months that I was out. So this is the period that I'm going to be covering. The first few days at the hospital, before the discharge, I had to learn how to walk and I had to learn how to talk. The main thing was doing the exercising every day, trying to walk with the walker, and then I was able to progress onto stairs. So at the hospital, that was the main recovery feature that I had to do. Plus I also had to learn how to get off the bed. I was given a large heart pillow that I had to hold very tightly toward my chest and do very smooth motions to not disturb the freshly cut sternum. The thing also continued at home because I had to be able to sit in the chair, get out of the chair, and also get in and out of the car. I always use the pillow to always hold it tightly, and I have it ever since. In terms of medication, I had to figure out quite a lot of things, but I had a PICC line that I mentioned in the previous video, the plastic tube that was inserted right in the vein, going through the body, resting on top of the heart, for very quick administration of medication. So I was taking antibiotics over the course of 8 weeks because to make sure that there is no infection left in the bloodstream. I was also taking heparin that was administered through the PICC line as well. And it's the medication, if I'm not mistaken, it's the anti-clot medication. It doesn't affect how thin the blood is, so that is the one that is used before and after the surgery. I'll be talking about medication that I have to take in my next video, but I'll just leave it there for now. So, physical recovery, I had to get my endurance back to at least some considerable level. So my first prescription was to continue walking and then build it up to the 30 minutes of consecutive walk. Now imagine doing it in the heat of June or late June in Washington DC. The only time I was able to do that was actually before the sunrise, because if I did it after, I would sweat like a fish and then I wouldn't be able to shower. Now showering is another thing that was super challenging. At times I couldn't do it myself because not only did I have to just stand in the shower, but also I couldn't make my right arm wet because it had the PICC line that was also preserved. So part of the treatment that I had to do was the visiting nurse. She was changing the bandage on the PICC line and then cleaning it about once a week or maybe maybe 2 times a week. So in short, that is what I had to do for the first few months and the week after surgery. Medication, of course, affected my hair. So those of you who remember seeing me at the store can recall that my hair looked a little patchy. I was very concerned at times, but things got back to normal. So all of it was effects of antibiotic. So there you have it. In short, for the first few months, right after the surgery, I had to figure out my medication pattern. I had to administer a lot of medication through the PICC line, which turned out to be not that bad. Then I had to figure out how to walk and talk and being able to get up and down. And then I also had to figure out how to take a shower. So those were all the challenges, but all of them were manageable. So that's about it. In the next video, I'll be talking about medication that I have to take right now, namely warfarin, because mechanical valve, warfarin for life. That will be a very big one, so stay tuned for it. If you're watching it before Christmas, Merry Christmas and a Happy New Year. I hope you're having a great week and find this video educational, beneficial, and maybe a little entertaining for you or for anybody who you know. Thank you very much. Take care.